Hello, everyone. Welcome. Thank you so much for joining us for today's Walk and Learn session. We're really excited to have you here as we continue along the 7-week journey towards better health, stronger community, and meaningful conversation. Just a reminder, if you're able to, we do encourage you all to stay active while you listen. So whether that's a quick stroll throughout the office, a walk within your neighborhood, or even just a simple stretch of the legs, the series is all about movement, mindfulness, and learning together. Just a quick introduction. My name is Afi Kole, pronouns she, her, and I am an incoming second-year medical student at Rush. I am also working with the Health Equity Office to help evaluate the impact of the walking program through the wellness survey. So just a quick thank you in advance for your part in that effort as well. So I'm very excited to introduce today's two speakers. We have Miss Julia Bassett. She is a Senior Manager of Health and Community Benefit and the Director of the Food is Medicine program at Rush. With nearly 2 decades of experience, she's been at the forefront of initiatives that bridge healthcare, policy, and community partnerships, ensuring the underserved populations receive the resources that they need. In her role, she oversees projects that integrate food security, public health policy, and community engagement into sustainable solutions to drive meaningful change. She's currently pursuing her PhD to deepen her research and leadership in food as medicine and community-based interventions. For exercise, she enjoys nice walks around her neighborhood. We also have Mr. Esequiel Salas, and he is a community health worker supervisor supporting a wide range of initiatives, including the Food is Medicine program at Rush. And in addition to this, he also leads evidence-based workshops such as Fit and Strong, which is a program designed to promote physical activity, improve mobility, and enhance quality of life for older adults. Esequiel is passionate about advancing health equity and strengthening community well-being, and is also currently pursuing his personal training certificate through the National Academy of Sports Medicine, as well as a master's in clinical nutrition. For exercise, he also enjoys running and rollerblading. And with that, I will turn it over to Ms. Bassett and Mr. Salas to help us get started.
Thank you so much. I really appreciate that. So I wanted to really start this conversation off with a question. What's one word that comes to mind when you think about food access and nutrition in your community? Some of the very specific words or one words that come into play that individuals have said prior to is inequity, access, hunger, limited, nutrition, affordability, deficit, food deserts, health insecurity, food insecurity, sustainability, lack of resources, sustainability, education, food apartheid, choice, barriers, freshness, availability, empowerment. Those are all really interesting words or interesting word choices we think about food and navigating some of the food access and nutrition in our community. However, fresh and healthy food is a basic human right. Wouldn't you agree? Everyone should have the opportunity to eat healthy food in their community and be able to access that food. Your zip code should not determine whether or not you have healthy, nutritious food. One of the really interesting infographics that we've seen in prior years is from the International Confederation of Dietetic Associations. And it talks about sustainable food. It talks about the fact that sustainable food is ecologically responsible, meaning low greenhouses and gas emissions. Soil and water quality is maintained and improved for the betterment of the community, but also to have healthy food. Biodiversity and ecosystems are protected and preserved. So that means that we have livestock that are treated humane and they live on a sustainable space. Fairness and accessible, meaning that farmers and fishers and food workers have a livable income, and that people live with dignity in sustainable rural communities, and that all people have access to basic, affordable, nutritious diet. We also think that it's important to promote justice and fair trade in countries in the global south. And it's also really important to support these farmers, fishers, and food workers, especially if you're accessing, some of the healthy and more sustainable foods from your communities. Sustainable food is also local, meaning that you can access farmers markets and you can have fresh vegetables that are grown by these farmers and fishers that have these livable wages that can also provide you with a nutritious diet. It provides high quality freshness, which means that food minimizes based on the number of miles that it's coming and traveling here to the state. As well, it supports local farms and fishers, producers, businesses, and development. We think about that when we think about Anchor Mission and just being able to support local organizations in the community that are doing this type of work. Another way of sustainable or having sustainable food is no waste, meaning packaging and waste are kept out of landfills and fewer resources are used to meet the needs and keeping the materials in circulation. When you think about sustainable food, you really have to have a holistic view of sustainability that's balanced. The environment is stewarded by social equality, local economies, and making sure that there's a reduction of waste. And lastly, healthy food is a key foundation for healthy humans. However, what we do know is the current state of food access in Chicago is very different. Chicago Food Equity Council that was established in 2020, it drives transparency and accountability, focusing on key initiatives. And according to the agenda for the Chicago Food Equity, 19% of people in Chicago metro area experience food insecurity. The rate rises to 37% in majority Black communities. Addressing systemic disparities is really important when you look at this holistically. You look at community organizations that are trying to address this. You also look at food insecurity is disproportionately high in communities of color, also highlighting the need to make some systematic changes. And then building a resilient food system is also really, really important, especially when we talk about food access in Chicago, because there are comprehensive strategies. Many of you have maybe even heard of policy reforms and maybe an increase for food assistance programs, especially during the time of COVID. Everyone was able to get some sort of grant if they were doing emergency food systems, and just making sure that you were having community based organization driving these initiatives in order to build resilient food systems. However, we know that some challenges are still there. And it's also really essential to ensure that equitable food access and improving public health outcomes by addressing these social drivers of health are economically stable, that neighborhood conditions are stable, that access to care are stable. The current state of nutrition in Chicago is 1 in 5 Chicago area families with kids are food insecure. The GCFD, or the Greater Chicago Food Depository, revealed that food insecurity among Chicago area families with children have risen to 20%, with food pantry visits increasing by over 50% since COVID. I would like to ask the question why? Why families with kids are food insecure? Rising food prices and the lasting economic impact of COVID-19 made nutritious food less affordable for families. Because there is a lack of income due to COVID and the closures of some schools, and the fact that there's a rising prices in foods and the lack of education and transportation to get those types of food made nutritious food less affordable for families. That's why we're in the current state that we are, that 1 in 5 children in families that have children are food insecure. And that's really unfortunate. If we look, I'll give a prime example. Many of you remember just a few weeks ago, eggs were $9 a carton for 12. And this was at our local area, Aldi. I had to go and do a survey of many stores, and Aldi, one of the lower cost stores, was $9. I went to a local market and a Jewel, they were $12.99 for 12 eggs. So you're literally paying $1.05 per egg. And it was very difficult for folks to get access to those types of food. And those are things that should be a basic human right. We just talked about that previously. Healthy food should be a basic human right. And it's very unfortunate that we have to experience that. However, what's really, really helpful is that we have programmatic things to help move towards a different mindset. And we will talk about that type of program soon. But what I would like to touch on are factors that impede food access and nutrition in Chicago. So, hopefully, many of you have heard the terminology food swamps or food deserts. Food swamps is a newer terminology that talks about the fact that we have your local bodegas that have the ramen noodles and the flaming hots. They're heavily saturated with the McDonald's and the KFCs and the fast food chains, right? But it is very unfortunate, like communities like Garfield Park are considered food deserts, where we have 36,000 community members and they have one, maybe two grocery stores. That's considered a food desert. So people are scrambling to get to a healthy, nutritious place to get a good grocer to support them and find fresh food. But it's unfortunate that many communities such as Garfield Park exist. And that's right here on the west side of Chicago. Some economic barriers are also a factor that impedes food access and nutrition in Chicago. So rising food prices, inflation, and low wage makes it very difficult for many families to afford nutritious food. You think about your Whole Foods in your local market. I call Whole Foods our whole paycheck. And Trader Joe's and Mariano's. Many of such are very, very, very expensive, or it makes it very difficult for individuals who are lower wage individuals that aren't able to afford the nutritious food. And then they rely on emergency food systems like food pantries, like soup kitchens to help support them. And it may not be the most healthiest food, but it may be healthy enough for them to eat at that time. We also think about systematic inequities and racial disparities. So, just as I mentioned before, you have Black and Brown communities that are disproportionately higher rates of food insecurity. And this is due to historical disinvestment. We think about white flight and redlining and just how communities are built, which cause systematic inequities and also racial disparities. And then it exacerbates the economic opportunities for those specific communities. So, again, that's a factor that impedes food access and nutrition in Chicago. Limited awareness and accessibility to assistance programs. So many of us have maybe heard of SNAP or WIC programs, but just imagine communities that are under resourced or don't have the education or lack of education, as mentioned in the chat. They may not have all of the resources or information when it talks about SNAP or WIC or how to apply, or if I do get denied, how do I reapply? What am I missing out on? And having that lack of information really, really, really has residents thinking that they're ineligible for specific resources when in fact they may have to just go back and answer one question correct. But again, if they don't have the education or the support to help them behind that, then of course we talk about stigma attached to that. And we talk about the lack of resources or information that accompanies the fact that the awareness is not there. So again, another factor that impedes food access and nutrition. And then we talk about grocery store closures, specifically in Garfield Park. And I touch on this a lot because this happened in 2021. All these just decided to close in the middle of the night. They didn't tell community members that they were leaving. And it was really unfortunate because you think about just Garfield Park itself has about 15 to 17,000 people that live in that community that access that store on a regular. And just imagine your grocery store closing down in the middle of the night. You don't have any details. You have no idea what's happening. We were at that location doing a food distribution, very specific because that community lost their grocery store and they had Thanksgiving coming, Christmas coming, and did not have an option to have healthy food. So it's really important that, these are things that impede food access in the city of Chicago, but then how do we help support communities? And it's really important to think about food delivery to our first community. And so we have our neighbors like Top Box, we have 40 Acres, we're working with Dion Stream. These are amazing vendors that understand that we have to support our communities and using them to help with the delivery program. So before delivery became a thing with those organizations, we delivered food to our first community. These are people who were in the hospital that were COVID positive that needed the support. We masked up and we helped to support those communities. We had employees at Rush who their situations were exacerbated. You have children that were home for the entire day versus having to just feed them lunch or dinner. You had to feed them 3 meals a day plus 2 snacks. So it's providing support to them, delivering food to our first community and making sure that they had the ability to still feed their families, but still be a first responder at the hospital. So really important that we were intentional about our efforts of working with very intentional partners who had our best interests at heart, but then also having volunteers to help support the community and do this amazing work. Some factors that facilitate food access and nutrition in Chicago. This is a really important point here. Community food programs, we'll talk about that one in a moment, but government assistance program, we just literally talked about SNAP benefits and WIC programs that really help low income families to access nutritious food. It's also making sure that people have the right education and support to process those applications to get them over the point. We have amazing community health workers, some of which Esequiel leads in this space, that help to set people up on SNAP benefits. They're like our super users, if you will, and we provide support with individuals who need that assistance. Urban farming and local food initiatives. This is really important. Initiatives like urban farms and community gardens, farmers markets, they increase fresh produce availability in underserved neighborhoods. Many of you may not know this, but Rush does have a farm. It's called Block 8. We also look at institutional and policy support. So I sit on a number of memberships in which there are city-led initiatives and also the Chicago Food Equity Agenda, where we are in improving our food distribution, but having conversations about how do we support and procure local produce from BIPOC growers and then eliminating barriers to urban farming. And then lastly, partnerships and private sector involvement. It's really important that we're collaborating between healthcare systems. So Rush University Medical Center, we are partnering with nonprofit organizations and community-based organizations such as Dion's Dream, Top Box, and 40 Acres. And this really helps us to expand access to nutritional support. So with that, I'm going to pass the mic to my colleague, Esequiel Salas. He's going to talk about some of the community food programs that are led by Rush University Medical Center.
Thank you, Julia. I am going to talk more about the Food is Medicine program that's currently at Rush. I am a community health worker supervisor, and I work closely with our community health workers in the Food is Medicine program. So a bit of our program is a prescription program that provides fresh produce and shelf-stable items to address food insecurity and promote healthier eating habits. So we are really pushing for our providers to screen for food insecurity as well as send in those referrals so we can quickly identify those needs as well as connect those patients to our 3-month food produce supply. I'm really proud to be a part of this program. I get to see firsthand how impactful this program is every single day. Picture this: instead of doctors handing out prescription for medicine, imagine they're handing out fresh fruits and vegetables. So that is what the VeggieRx is all about. So here at Rush, we truly believe that food is medicine. I firsthand have seen how can our plate be just as powerful as what's in a pill bottle. So through this program, we provide fresh produce and healthy pantry staples, things like brown rice, beans, oats. I've even heard patients say to me that they haven't had fresh berries in months, or sometimes they're usually skipping vegetables because they're just too expensive. So Veggie RX is really trying to change that narrative. It's not just filling a bag with food. It's helping people bring healthier options that can truly change how they're feeling, both day to day and also long term. Through the VeggieRx pantry, like I've said, patients are not only receiving that fresh produce and healthy pantry items, they're also connected to long-term food resources. And by that, I mean they're connected via Unitas, a platform we're using. We are, based off their zip code, we are able to send them a list of local food pantries near their home. We're also providing them with education and as well as recipes and just how nutrition impacts their overall health. So at its core, the VeggieRx is more than just food. It's about empowering people with the resources, knowledge they need to live a more healthier and fulfilling lives. At Rush, we know that health isn't determined just medical care alone. It's also shaped by access to food, housing, transportation, and other basic needs. We want to meet patients where they're at, so that's why we're screening for social determinants of health. Healthcare providers can immediately refer them to our program, connecting them with fresh produce, healthy pantry items, and ongoing food resources. So I truly believe by combining the screening with the food is medicine program, we're able to identify the need earlier and act quickly. We're able to address one of the most critical drivers of overall health, and which is consistent access to that nutritionist food. So we ground our work in evidence-based practice. We're using data and proven strategies to design interventions that are directly address food insecurity and improve those health outcomes. We truly believe in patient-centered care, making sure nutrition is built into care plans, supporting chronic disease management, and looking at the whole person, not just their medical diagnoses. We're deeply committed to equity and access. So we're ensuring that underserved communities have reliable access to healthy, affordable food they might otherwise go without. We prioritize collaboration and support, so partnering with community organizations and across sectors to create sustainable community-driven solutions. I actually handle the work referral queue, so we're seeing a high demand for our program, but that just shows the climate we're in now. Benefits are getting cut, and just the rise of cost of living is increasing. So we're keeping our eyes open on outcomes. So we want to track our impact. We're measuring improvements in quality life, and we're seeing real reductions in chronic illness among those we're serving. As a clinical nutrition student, I am continuing to find innovative ways of how we can expand our services in the pantry. So I'm just excited to continue learning and continue working in the space.
Thank you so much to you both for that amazing presentation. I think it's really important to recognize and remember that medicine and health is holistic, and that it's not only just the pharmaceuticals, but everything else that encapsulates just healthy being. And I think we also tend to forget that, yes, medicine as well as healthy eating and exercise helps the patient, but in doing so, we're also addressing a generational change. If you're hitting the parents, the grandparents, that trickles down. We want to now switch over to the Q&A. The first question we have is from Rachel. She asks, the sector has been heavily anchored on incentivizing either fresh produce or fully prepared medically tailored meals as food is medicine so far. What opportunities do you see to address the nutrition security needs of a broader swath of patients beyond those two intervention types?
Yeah, so thank you for that question, Rachel. I will start off, and Ezekiel, you definitely can chime in. So integrating nutrition into primary care and preventive services is something that we are heavily thinking about as we have talked to some of our clinical nutritionists, but we are talking to our preventive medicine team to integrate nutrition into their process. And then how are we able to couple our services together? So that may be training some of the primary care providers to screen for nutrition and security alongside food insecurity. That's something that we've talked about. We also talked about embedding registered dietitians with the community health workers into clinics to offer brief, actionable counseling. Maybe having the nutritionists from the fourth floor to have them come together and provide that support together. So knowing that this person may have a chronic condition, then working with the nutritionist to talk, or dietitian rather, to talk about some actionable outcomes that that patient can take part in, and then receive those services free here at Rush. We've also talked about our Epic records to track nutrition risk over time and coordinate follow-up. Just providing a holistic bit of services for our patients will be really important. So yes, they're getting the food from the Food is Medicine Pantry, but then how do you educate that person? How do you make sure that they have a well-rounded balance? So that may mean a healthy cookbook. We do have that, but it may be nutritional classes on how to cook that food. It may also be exercise classes. Ezekiel does a class called Fitness Strongest for senior adults. About 76% of our population are older adults, seniors between 50 and 70 years old. And so being able to incorporate all of those things. So it's, again, not just about the food, it's really about taking steps to coordinate your healthy regimen over time, number one, but then also control that chronic condition if in fact you have that, and then manage it over time with a healthy, balanced diet.
I think pretty much Julia mentioned all of it. But I think a key factor is, for example, I'm working with the population with chronic disease management. So I want to know, what are they eating besides just me going there and teaching them how to work out. And then luckily for us, we have the Food is Medicine program that I'm grateful that we're able to use some of those produce and fruits to give to those patients that are actually working out as well. So they're getting a 2-in-1. So just doing that work drives me and continues to give me ideas on how we can further be impactful in that Food is Medicine program.
Thank you. I do have a personal question. Being that I'm currently in school, how can healthcare providers or students just like myself better incorporate food and nutrition into routine care and treatment plans for a patient?
Absolutely. So, what I will start by saying is that we have a number of students here at Rush that are heavily involved with the program. And so they get a chance to volunteer and support in the pantry so they understand the process that goes into this. So it's not just making a referral, but it's really understanding what that referral means for that patient. So when you're thinking about incorporating that into primary care, it's, will this program be able to help this patient that's chronically ill? If in fact that it can, what kind of foods will this patient get? Understanding the food and the balanced diet that we're providing for this patient population, and then also being able to incorporate that and be able to say, I can, as a provider or a student looking to provide care, refer this program and holistically know what this program is going to do for that patient. Because it's not just about, oh, we're going to get you a referral for 3 months of food, but it's really understanding the process and the thought process that we have into going into this food, right? It's not just that we came up with an idea to throw some things on the shelves, but it's clinically healthy food that we work with nutritionists and some psychologists on putting those specific things on the list and the shelf stable items that we have. So it wasn't just, oh, we have to have this, but it was thought out really well. And that's what really went into creating this program. When you're providing that referral to patients, then they are getting a full, well-rounded understanding of the program itself and why they were being referred to the program.
Thank you. We do have another question. There is a conception that certain communities don't want to be quote unquote healthy. Can you talk about how and why this thinking can be harmful?
Yeah, this is a really, really, really important question. It's not that communities don't want to live healthier; they can't afford it. It's expensive to be poor. It is expensive to be poor, especially in a community where you don't have the access to the right types of food. It's really difficult to eat healthy. People think it's really expensive to eat healthy. Let me also say that there is a lack of education on how to cook healthier and inexpensively for your family. There was a book that was developed a few years ago that says cooking a meal on $4 a day. Create food that's in your kitchen that actually could be healthy. And people don't realize that that could be healthy. Okay, so it's expensive to be poor. You can eat the things in your kitchen under $4 if, in fact, you have the right recipes and education and nutrition in mind. However, communities, again, are saturated with food swamps. And you can go to McDonald's and get a meal for $5. That includes a protein, a carbohydrate, and a fruity drink that will cost $4 or $5. And it's actually cheaper to cook a meal at home for your family at $4 if you have the right education and nutrition in hand. But again, when you have these areas where you have large groups of people that live in these communities, and you can go to your local McDonald's, White Castles, KFC, and it seems inexpensive to eat, that's what people know. So you are a product of your community. If that's all you know and that's what your parents have taught you and that's what you know, you tend to lean and gravitate towards that. However, it's just an educational component, and it's also showing people by cooking demonstrations that you can eat healthier, that you can have a more healthier life if in fact you you do things just a little bit different, tweak a few things. And so in the pantry, we're able to talk a little bit about that with our patients and say, if you tweak this, maybe not eat white rice, but try brown rice or try lentils. If you season it this way, it tastes good. So we have people who, patient choice over everything, right?
Mhm.
However, we do acknowledge that people will try things that are a little bit different. So we have been in that situation where, patients, they want to eat healthier, they just don't know how. And so through this program, we've been able to educate them just a little bit more on how to eat healthier, and do it within their budget and their means that's in their bank account, if you will.
And that's actually a perfect segue into the next question that I wanted to ask, being that the United States, everyone's coming from different walks of life. How do you ensure that the food and recipes, either tied to the food as medicine program or elsewhere, continue to stay culturally relevant? And so that people aren't losing their sense of connection to their culture or their background.
So when we developed the cookbook, we were intentional about the people that were coming to our space. 70% or 76% of the individuals coming are Black and Brown individuals, and they're older adults, again, between the ages of 50 and 70. So, of course, we think about our Spanish population. We know that tortillas, black beans, brown rice are a staple in homes, right? So we have to have those things on the shelf. In African American homes, we know that greens, cornbread, spaghetti, and pastas are something that are staples in homes. But we also have to acknowledge that those are things that their families are going to want to eat. But how do you prepare them a little bit healthier, right? And so when we developed the recipes with one of our nutrition students, we were intentional about keeping those staples in homes. But how do you cook them a little bit better or cook them a little bit differently to make them healthier? We had done a cooking demonstration about, I want to say earlier this year, and it was, how do you make black eyed peas? And this is a staple in Black homes, especially at the top of the year during holidays. How do you make it healthier and it still tastes good? And so we had some challenging taste buds in that space, but you have to try it a few times to try to get adjusted to the taste. And not that it tastes bad, it was just different. And I think that people need to understand that different is also good. And so again, we provide those staples in the space. We also make sure that folks have a cookbook, but then now we're starting the educational component, the nutritional components to build onto that. The recipes are things that are on the shelves. I think that that's also really important. They're not just you're going to get a cookbook on how to make lentils, and we don't have lentils on the shelves. So the cookbooks is intentional about having things on the shelves that also people would be able to cook.
And I think specifically with the tortillas, I know when I'm in the space and I am seeing patients, I see how surprised they are to have that. For us itself, like I'm continuing to learn about different types of food. I think the important part is, like we mentioned earlier, is the lack of education. And that's what I've seen across everywhere, even in my own personal like family. I think I felt like an oddball when I first was transitioning into kind of eating healthier. I was kind of seeing like, what are you doing? Or what is that's nasty. It's food that we never grew up with. So just learning throughout my journey, just learning the impact that food has on the body and how much out there is. I just think that there's people that don't know how to eat healthy, but even just small improvements, like small changes, there's still an alternative for everything. And that's what I think we need to keep pushing. For me, it's very mindful eating, just how food is making us feel. And I encourage everyone to start maybe a little journal diary and eat a certain type of food and then wait an hour and see how you're feeling. I always tell all my patients, I always tell my family members, my friends, if food makes you tired after you eat it, then you're not eating the right food.
I think that's a great reminder that foods and meals can be different, but that doesn't necessarily mean that you can't enjoy the process of eating.